So today again one more important topic, that is the thrombolytics. The thrombolytics is administered to disseminate the coagulation or to dissolve the coagulation, means the blood clot or the emboli. So in this topic first we discuss the PAR inhibitor, means the protease activated receptor. PAR as the PAR, protease activated PAR inhibitor. PAR inhibitor means protease activated receptor. Okay. The PAR inhibitor, that is the PAR inhibitor means the protease activated receptor, that is the PAR inhibitor. So this is the long-term prophylaxis of MI. The long-term prophylaxis of MI, myocardial infarction. The PAR inhibitor is the long-term prophylaxis of MI, means the myocardial infarction. The PAR inhibitor is contraindicated in stroke. Contraindicated in stroke. Clear? The PAR inhibitor always contraindicated in stroke patient. Always remember, the PAR inhibitor is contraindicated in stroke patient. The drug is the ticagrelor. The drug is the ticagrelor. The ticagrelor is the PAR inhibitor. The PAR inhibitor. Then we move to the another thrombolytic agent, that is the streptokinase, that most commonly used in the MI patient to dissolve the clot or the emboli. That is the streptokinase. The streptokinase most commonly used in MI patient. Clear? The streptokinase is a thrombolytic agent that most commonly used in the MI patient. So the streptokinase is the mechanism of action. MOA means the mechanism of action, that is the tissue plasminogen activator. The streptokinase is the TPA, means the tissue plasminogen activator. So it increase the plasmin in our blood. So it increase plasmin. It increase plasmin. It increase plasmin in our blood. In the streptokinase, The side effect is the hypersensitivity. The hypersensitivity. SE means the side effect. Side effect is the hypersensitivity. Hypersensitivity. The side effect of streptokinase is the hypersensitivity. Hypersensitivity. So another, the thrombolytic agent is the tactiplase. Reticlase is the also the thrombolytic agent. Then the common uses of streptokinase. Common uses of streptokinase. First one is the STEMI. Second one is the ischemic stroke. Is the ischemic stroke. That means the sufficient blood do not reach the target organ, so the ischemic stroke has been occurs. So third one is the massive pulmonary embolism. Massive pulmonary embolism. The streptokinase is also the used in the massive pulmonary embolism. So the streptokinase, the common use of streptokinase is, first one is the STEMI, then second one is the ischemic stroke, and third one is the massive pulmonary embolism. What is the meaning of emboli? Emboli means the floating clot. So the if floating clot lodged into the lungs, that cause the pulmonary embolism. So in this case, we also use to dissolve the clot in lung. We also use the streptokinase thrombolytic agent. Then the antidote. The antidote of streptokinase is aminocaproic acid. So it is important, the antidote is the aminocaproic acid. The antidote of streptokinase is the aminocaproic acid. Then we move to the contraindication of thrombolytics. Contraindication. First, the contraindication of thrombolytics. First one is the brain tumor. And second one is the recent surgery. And third one is the aortic dissection. And third one is the aortic dissection, aortic dissection. Then fourth one is the intracranial bleeding history. Intracranial bleeding history. Then fifth one. Fifth one is the non-compressive vascular puncture. Here the vascular puncture. Vascular puncture. So in this five case, there should be thrombolytic agent should be contraindicated. In the brain tumor, the perforation may be chance, so the thrombolytic agent may be contraindicated. So recent surgery, then aortic dissection, then the intracranial bleeding history, then the vascular puncture. So in this case, the thrombolytic agent should be contraindicated. So this is all about the thrombolytics. Clear? So thank you.